3 over-the-counter medications you may need to avoid while taking prednisone. Hi, I'm Dr. Megan, the prednisone pharmacist, and I'm here to share with you 3 things you need to avoid when it comes to over-the-counter medications. But I have a bonus for you. How about 3 over-the-counter medications you may want to take to help prednisone side effects? Now, I've been a pharmacist for 15 years, and so I've seen a lot of over-the-counter medications and a lot of prescriptions for prednisone in my time. So, what do you need to avoid? Well, the first thing to understand is that prednisone is a steroid. It is a corticosteroid or a glucocorticoid, and that is exactly why we're going to need to avoid the over-the-counter medicines I'm about to tell you about. It is a steroid and it works. How does prednisone work? What is it used for? It is an anti-inflammatory. It turns down inflammation. Any disease that ends in itis means inflammation, and it's going to help turn that down. And so the medications that are used over the counter for inflammation and pain, we need to avoid because they are non-steroidal anti-inflammatory drugs. The first one is the most common one you'll see, and it's called ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug. Another name for it is Motrin. Another common one you'll see is Advil. Advil, Motrin, ibuprofen. It's all the same thing. And we need to avoid it because it is working in similar pathways in our bodies. So prednisone is using one pathway to get rid of the inflammation. And ibuprofen is using a similar and yet different, but similar enough that it's causing a drug interaction. And why would you care? Well, because this is causing a side effect called ulcers or GI upset or gastrointestinal problems or holes in your stomach. There's many ways you can call it GERD, gastroesophageal reflux disease. Essentially, when you combine these 2 drugs, prednisone and ibuprofen, what it can do is make it so that the gut lining isn't as strong as it otherwise would be. And so you may get a hole in your gut or a thinning of the gut lining. And if you get a hole, that can lead to bleeding. And people actually have died from gastrointestinal bleeding because of this kind of a drug interaction. So we want to avoid that if possible. There are other medications in the same class of drug as ibuprofen. That includes naproxen, which is also over the counter, but there are also prescription versions of NSAIDs, such as meloxicam or Celebrex, and there are a whole bunch more. But those are the most common ones that you might be prescribed by your doctor. So you'll want to avoid any NSAIDs with prednisone unless you first get clearance from your doctor that this combination is okay. For some people, it is okay. For some people, the combination is worth it because you might have so much pain that you're willing to run the risk of that GI upset. But for most people, that's not a risk worth taking. So I would recommend to avoid this combination if at all possible. Now, you might have some questions about this combination. If you absolutely have to take it, one and the other, is there a better way to do it? And yes, there is a better way to do it. Taking ibuprofen at least 24 hours after your last dose of prednisone is the best way to do it because then the prednisone's completely out of your system. Or vice versa. If you take the prednisone at least 24 hours after your last dose of ibuprofen, that's a good combination as well. What about aspirin? So aspirin is another drug that is working in a similar way. It's used for a similar reason, right? It's used to help with pain and inflammation, often for headaches and things like that. So we want to avoid aspirin as well. So the first was ibuprofen, the second was naproxen, and the third is aspirin. Those are the 3 over-the-counter medicines you want to avoid. But I have a bonus for you. How about 3 over-the-counter medications you may want to take to help prednisone side effects? So first, you might be wondering, well, if I can't take ibuprofen and I can't take naproxen and I can't take aspirin with prednisone, What do I do if I get a headache? Well, there is one option that's over the counter that you can take, and that's generally accepted as Tylenol. You can take Tylenol, which is also known as acetaminophen or APAP. Anything with that active ingredient, acetaminophen, in it is generally approved and safe for people on prednisone. But what's important to know about Tylenol is that there's a maximum dose you can take per day. It can be quite hard on the liver, and so you want to make sure you're taking 4,000 milligrams or less per day, because otherwise it can be harmful. And it depends on if you already have liver problems. You might need to have a lower maximum dose than that. And so what's really important is there are lots of medications that might have acetaminophen hiding in them. So obviously, if it says Tylenol, it probably has acetaminophen in it, but it might not. There are actually things that have Tylenol in that say Tylenol that may not have acetaminophen. They might have another ingredient similar, but isn't actually acetaminophen. And then there might be things that you think have no acetaminophen and they do. So you got to check the back of the label to make sure whether it says acetaminophen or not, and take less than 4,000 milligrams per day. So for example, this one has 500 milligrams in it. And so it's the extra strength tablet, and you'll want to keep your maximum of this one is whatever 4,000 divided by 500 is. That's 8 tablets per day. So you want to take less than 8 of these per day to get the pain relief you'll need while taking prednisone. What else can you take to help counteract side effects as an over-the-counter medication? So I mentioned that the combination of these two drugs can cause stomach upset. So what could you do? One thing you can take is an antacid containing calcium carbonate. That way, it's giving calcium to kind of help coat the stomach, and that can ease the stomach upset. But this isn't going to prevent ulcers. It's just going to kind of ease the symptoms that you're experiencing. But what is really great about this is it contains calcium. And everybody who's taking prednisone for more than 3 weeks is supposed to be taking some form of calcium the entire time they're taking it. So this is one way you could get the calcium you need. Another stronger option to help prevent that upset of your gastrointestinal system is called omeprazole, or anything else ending in prazole. So you can compare this to Prilosec OTC, and other ones include Protonix or Nexium. There's a whole list of other medications that end in prazole, and any of those could be helpful to help prevent that side effect. So if you absolutely must take prednisone and ibuprofen, then you also need to take omeprazole along with it to counteract that side effect. This is what you should do. If you have to take these two, then you also have to take the third one to counteract that side effect. So these are 3 helpful over-the-counter medications that you can take to help counteract prednisone side effects. And I have an entire list of things that you should avoid while on prednisone. And if you would like a copy of my list of things to avoid while on prednisone, just click the link below and download it now. Signing off is Dr. Megan, your prednisone pharmacist.